Welcome back. Apparently my red dress is at the cleaners.
Yeah.
You guys. Dr. Kohli's with us today. We're talking about white lung syndrome, not a new illness, but there are new reports now of a spike in cases here in Ohio as well as in China.
Our 9 health expert, that's why we brought her in, Dr. Kohli, to talk about what we need to know. White lung syndrome, not something that I think that doesn't roll off the tongue, for one, but most of us haven't really heard much about.
It's not a real syndrome. In fact, It's not even a term that's recognized in the medical community. It's just something that's trending on popular media. So what a white lung is a lung that looks white on x-ray. And there are a number of different things that can cause it. Anything that fills the lung with fluid, like water, inflammation, blood, even scarring. So anything that causes a lung infection can cause a white lung and chest x-ray, and that's really what we're seeing here described as this white lung syndrome.
And is it concerning because there is in fact a spike? You are seeing that there is a spike in Ohio and China as well.
Yeah, so we're actually seeing spikes all over the world, Tom. We're seeing this in China, 3,500 kids having these pneumonias that are ending them up in the hospital. In Ohio, as you mentioned, 145 kids in Denmark and all over Europe. But what we're not seeing is a new pathogen, a new virus, or a new bacteria.
But if there's a spike, there's a communicable disease is what they're concerned about, something that's spreading.
That's right, but it's winter time. So, respiratory viruses spread during winter more efficiently. Our kids, I would say, have sort of had their immune system out of shape for the last few years because of the COVID-19 pandemic and masking and all that. And the masks sort of came down at the same time. So all of this put together to me is the reason that we're seeing many of these kind of little mini outbreaks occurring, so to speak. But it's really reassuring that according to the World Health Organization, this is not a new virus like COVID-19. This is not a new infection. These are the same old friends that we see every winter, or enemies, I should say. And we just need to do a little bit better about protecting our kids because many of them are getting very sick with it.
Yeah, I think people panic when they hear the China connection alone, given the history. Does it present like a respiratory, like a typical really bad cold, or?
Yeah, so most of these are being caused by something called mycoplasma. Mycoplasma is a bacteria that causes something called walking pneumonia. And we call it walking pneumonia.
Heard of that, yes.
Yeah, because you can be walking around with it, meaning you're not sick enough, even though you have a big infection in your lungs, to end up in the hospital or on a ventilator, but you're certainly sick enough to be needing antibiotics. And so most kids will present with a kind of upper respiratory cold-like symptoms. Sometimes you can have gut involvement, so you can have diarrhea as well. Adults will present the same way, sometimes with fever, malaise, and sort of feeling under the weather. Interestingly, in China, we're seeing some atypical presentations where people are not having the usual sort of pneumonia symptoms, some of them even coming in with lung nodules, which can be a sign of inflammation as well.
Is this something where we're going to see more and more people getting chest x-rays when you come in and present? They're going to have to take that picture?
I think we should, yes. And I think that, to me, that is what the learning lesson is here, is that this particular year, because of the way that the infection seems to be spreading, because of the fact that everything came in together, the masks went down, the winter season, our immune system's more naive, we have to have a lower threshold for getting a chest x-ray to make sure the airways are not whiting out, because that would be a sign of aggressive treatment, more antivirals, more antibiotics, et cetera.
Quickly, do you expect this to spread? I mean, we're talking about Ohio, but I mean, it sounds like if it's there, it's going to be in other places too.
I don't think it's going to come from Ohio to here, but I think we have our own little pockets here,
right,
which is why we need to remind our kids with, hand hygiene, masking, and the vaccines. I can't emphasize that enough. The vaccine uptake has been so disappointing this year, right, which to me, after everything we've been through, I thought we would have learned our lesson not to play with that fire.
All right. Well, we always appreciate you bringing us the information. You can also find more health headlines at 9news.com/askdrkohli. Thank you, Doc.